All right, hi guys. I am back and I have lost weight. I have a lot to share, and I'm going to be sharing a lot more um, in the future and a lot more regularly again. So, my big news is that I had VSG, that's vertical sleeve gastrectomy, and that is a bariatric weight loss surgery. That was in October. So I wrote a little list of kind of what I want to go over. So just the whole process. And this will be about from my pre-op, scheduling the surgery, and all the way to about 2 weeks post-op, just what I experienced during that time. So, I did go with Blossom Bariatrics in Las Vegas, Nevada, and I went there because my personal insurance through my work would not cover my surgery. They only do bypass, and I would have had to gain some weight because my BMI was just below 40, and so you have to be 40 or above, or you can be 35 or above and have either one or two weight-related medical problems like sleep apnea, diabetes, hypertension, high blood pressure, something like that, which thankfully I don't have and I haven't had. But I didn't want to get there, so I wanted to take care of this before. So we went with my husband's insurance, and they were able to cover that piece with a deductible. So the deductible was pretty high, the copay or whatever you want to call it, but it's okay. So if you want to go there, if your insurance doesn't cover bariatric surgery, that's maybe a possibility for you, to at least call them. They were really great about taking care of the insurance. I just gave them the information and they got the authorization and everything. So I scheduled it in the summer of this year, that's 2020. Sorry, my kids are running around. And I scheduled it for October 15th. So they were maybe, I think I was about like almost 3 months until the surgery. So they were really booked up. And that's probably because they had to close down for the pandemic for a little while. And so between the summer and October 1st, which was the start of my 2-week pre-op diet, I basically went on a full-blown food funeral. And that means that I was gaining more weight and eating whatever I wanted because I knew that I was going to have this surgery and I wouldn't be able to eat again, or at least eat what I wanted and as much as I wanted for, well, basically the rest of my life. So when I had my pre-op diet, when I started my pre-op diet on October 1st, I weighed 241.2 pounds. So yeah, I gained a lot. And so my pre-op diet was for 2 weeks, and it was a protein shake for breakfast, protein shake for lunch, and then kind of like a lean and green dinner. So you could have, I think, like 5 ounces of lean protein and like 2 cups of green vegetables, or just any kind of vegetables that isn't starchy, like no corn or potatoes, something like that. And then throughout the day, if you need to snack, you could have cucumbers, they said, which I didn't do that because that's not very satisfying to me. And then did I cheat during that time? I think I did just a tiny bit, but the purpose of the pre-op diet is to shrink your liver so that when they are moving everything around, that they have room to cut your stomach and make sure that they don't cut anything else. So that really scared me. I didn't want to have a big liver and get it all cut up or one of my other organs cut up, you know. So I think the fear was a good driving factor. So I lost 11.2 pounds with that, and so my surgery was on October 15th. We flew out a couple days before that, so we flew out Monday morning, and then my surgery was Thursday. So Monday we got there, and then we just, they transported us to the hotel, and we were just able to kind of hang out, and they didn't require any appointments or anything. Tuesday, we had the pre-op appointment, which just goes over like blood tests and goes over everything that you're going to go through basically. Wednesday, the day before, I had the EGD, the endoscopy that goes down your, they put you under to sleep, and it goes down into your throat, into your stomach, and the very first part of your intestines. And that's just to make sure that everything looks fine. And they also take a biopsy, which will go to pathology for results. And they didn't find anything. It said that they checked for H. pylori, which is an infection in the stomach lining. And then they also checked, you know, for any inflammation or, you know, cancer or something, anything that they would find. And so they didn't find that. And the process of the endoscopy, I was really scared because it's not something I've done before, and I don't like the feeling of going under, you know, anesthesia. So just the falling asleep piece kind of freaks me out. But it was fine. It was just like a really good sleep, and I woke up just kind of sleepy, and it was fine. I didn't hurt at all. My throat felt like a little bit dry, but it didn't hurt, and I could eat right after I got out. And then, so for the rest of that day, that was done early in the morning. Like, they came to the hotel at like 5 or something to pick me up. And so I got back to the hotel sometime still in that morning. So we went out and kind of did some sightseeing and stuff. And then the day of the surgery, you know, they took me there, and they of course did the surgery, which again I was really scared for because I didn't know what was going to happen, you know, because I mean I knew it was going to happen obviously, but I didn't know what to expect because each person I think is just a little bit different. You can be. Oh, the other thing they checked for in the endoscopy was a hiatal hernia, which I did have, and that's just where part of your stomach comes up into your thoracic cavity. So, you know, it's not supposed to be there, past your diaphragm basically, which is what helps pull your lungs down. So they had to repair that, which was nice because I haven't really had much heartburn since then, and that's supposed to help. So that is another point of the endoscopy. So they did the hiatal hernia repair, and they did the sleeve gastrectomy, which is cutting, you can look that up, but it's cutting out about 70 to 85% of your stomach, and it just leaves kind of a tube that they call the sleeve. And so it looks like your esophagus just goes down, and then, you know, and so they did the hiatal hernia repair. I woke up and I was in so much pain, and it was all in my left shoulder. And that was partially from the gas, because it's a laparoscopic surgery. So they blow up your stomach. They insert, you know, little tools into your stomach, and they blow it up so that they have room to see and to move everything around and perform the procedure. And so from the gas, for some reason, a lot of times the gas will go up into your left shoulder just based on the anatomy, and that's where you get the pain. But I also had pain from the phrenic nerve, which is radiating from the hiatal hernia repair, the stitches that they did there. So I didn't have any pain here in my abdomen, you know, mild pain. It was just kind of sore, I guess. But the pain in my neck, my shoulder, was severe, and they were trying to get me up and walking, which I did, but I was telling them, I am in so much pain, this is ridiculous. You know, that's probably the only part of the experience that I didn't like, is I think they were trying to close down the surgery center, and so they wanted to get me going and back to the hotel, because they just send you back to the hotel within like an hour of waking up. So I got back to the hotel. I was crying the whole ride home. I was saying, I need somebody to kill me. So I hope this doesn't scare anybody, but it was really from the hiatal hernia repair, and that's what the surgeon said, and that's what everyone else said. It was a very large hiatal hernia. I do have other friends who've gone through this surgery and had the hiatal hernia repair as well, and they didn't have this extreme pain. Also to add, I do have chronic pain in this area, and so I think it was a combination between those two. So I'm back at the hotel. They give you, well, they gave me oxycodone. They give you something like that, opioid for pain med. And I'm back at the hotel. I took 2 of those because they said you could take 1 or 2, and if you're in any pain at all, you should probably take 2. So I did. That was so hard to swallow. I think I cut it in half, but it's still a pretty big pill. Like, it's at least a big Tylenol size or more. So I got that down. Didn't feel like it was helping at all. It was about 6 hours from my surgery to when the IV treatment person came to the hotel, which that was a lifesaver. They started this apparently a few months ago, where they send an IV, I don't know if she's a nurse or an aide or something like that, but she gives you an IV through your midline. Sorry, I forgot that too. They give you a midline, which is an IV that goes into your upper arm, and it just goes up kind of a few inches. It's not like a central line which goes to the beginning of your heart, but it's your heart's here, and and it just stays in, just so you don't, because it's more secure and they can leave it in for longer, unlike just a regular IV, which you can only leave in for, you know, a few days or a week at most, and it can be compromised pretty easily. So they like to do the midline, which is better tolerated. So she just hooked that up, and it was a bag of pre-mixed IV fluids and medication, which I think she said had Toradol. Well, I know it had Toradol, and I think it also had Zofran. I didn't have any nausea. No nausea at all. No vomiting. Still haven't vomited. That medication, and she tucked me in bed. Oh my gosh. That was the best ever. She like tucked the pillows like nurses do. You know, if you've ever been in the hospital, they help you. And within like a half an hour, I was asleep. And you were supposed to wake up every 2 hours, I believe, to walk around to make sure that you don't get a blood clot, just so you keep moving around. They also did give me compression devices that squeeze your calves, which helps the blood flow. But I did not want to wake up when my alarm went off at 2 hours, but I did. It was just a miracle to be able to sleep. And after that, I still had quite a bit of pain. Like, I would say it's severe pain, but I wasn't asking everyone to just kill me anymore. So I would say I'm probably one of the worst cases as far as the pain goes, because of the chronic shoulder pain and the hiatal hernia pain. So if you can just get through until the nurse comes that evening, or if you're in the hospital, you should be so much better, because they're going to be giving you IV pain meds all the time. So after that, I was pretty good. Then the next day, Friday, they take you into the clinic there again, and they give you another bag of fluids and Toradol through your IV in your midline. and then they will take it out. They take all your vitals and make sure you're doing okay that way, and then they take it out. At that point, I only had probably about 8 of the, well, 8 to 10 of the 20 oxys that they gave me, because I was having so much pain and I was just taking it all the time. So in that first 24 hours, I was taking 2 every 4 hours, and it was a lot of pain. And so I asked them for a refill, and thankfully they did give me a refill, which I didn't end up using all of, because I just used it when it was so bad. And then other times I just used Tylenol. You can, well, you have to ask your surgeon, but my surgeon said that you can take Advil or Aleve, but you just have to take it very sparingly, because even for a person who has a normal stomach, it is irritating to your stomach. So it can have irritating effects, like causing ulcers and, you know, breakdown of your stomach. Sorry, that's my son still. Okay, so then that's the first that's the first couple days. And then so Saturday, Friday we just stayed at the hotel. I didn't want to go anywhere. Saturday we went home. Luckily, we only had a couple-hour flight to go home, and that was fine. I just took a couple of the oxycodone before, and that actually calmed my nerves on the flight, because I was just so sleepy. It really knocks me out, because I'm not used to taking those kind of meds. So I got through, and then we got home, and I pretty much just rested. I had 2 weeks off from work, so that was nice. So the first week, I'm just looking at my notes here, it was hard to drink. It was hard to drink enough. Like I was just able to sip, like tiny little sips, like as much could fit on my tongue. Like, you know, like a half a tablespoon, maybe at most. And I would just sip that. That kind of was okay. But if I would try to have any protein drinks, that would just feel like it was hitting my stomach like a rock, and my stomach would start cramping. Yeah, it was awful. So I was just sipping on those kind of all throughout the day, and I was feeling pretty dehydrated. So I did go in to my primary care maybe about 1 week, and I got IV fluids again. And that was the only time since surgery I have. And I probably could have gotten away with not doing that, but you know, I asked them if I could, and they were fine with it, because I was having such a hard time getting the fluids down. And so the second week, I was starting to feel a bit hungry, and like I wanted to eat something. So I ended up having like a thin yogurt drink. I think it was like the Chobani smoothie. A little bit too much sugar, you know, than is ideal, but it was some protein, and that was the most delicious thing ever once I had that. So, you know, follow what your surgeon says. They had me on a 2-week full liquid diet. So they didn't say yogurt was okay, but technically yogurt's a full liquid. So I think that was okay. And then I was still having the pain quite bad. I was still taking the oxycodone every couple days, because I would try to just get through it, like with a heating pad, with resting, you know, things like that. And so they give you the surgeon's on-call surgeon's number. So I called them and told them what was going on. I told them at 1 week, and he said, it's fine, it's a hiatal hernia, yada yada, it's fine, whatever. It can go on for up to 2 months, he said. And so I was like, okay, fine. And this day that I called at 2 weeks, that was a call at 1 week. And then at 2 weeks, I called because I was just crying in pain. And I think I tried taking 1 oxycodone because I didn't want to keep, you know, feeling so drugged up. And, you know, you don't want to get yourself addicted to that stuff. And, you know, it's not good to keep taking. So it didn't really help, the 1, like, at all. Maybe it made me feel kind of sleepy for about a half an hour at most. You know, you just don't care about the pain, but that's as long as it lasted. So I called the surgeon on call, and it was a different person, and she said, you need to go to the emergency room and get, my son's getting into chips, and okay, sorry, I had to go get my son. So she said, go to the emergency room, get a CAT scan, and call me back. That was it. She didn't say, oh, I'm worried about a blood clot, or I'm worried about something went wrong with your surgery. So I'm thinking, what happened? What's going on? So I go to the emergency room, and of course it was like one of the busiest nights there. It wasn't Friday, it wasn't the weekend, but it was super busy. You know, the evenings are, but so I went in there and I told them, you know, that I had the bariatric surgery and what the surgeon told me to do, and they said, well, we're going to get you worked up. We're going to get an EKG, chest x-ray, and blood tests. So they did all that. Then they sent me out to the waiting room. So I was just waiting. It turns out after spending like 6 hours there, which they don't let you, you know, they don't let you eat or drink. And so here I am 6 hours with not doing my sips, which is hard to catch up if you go so long without that. They said everything looked fine. The labs looked fine. The chest x-ray looked fine, and they're not going to do the CAT scan. So I asked them if they could give me another Toradol, which they did, thank God, and that helped so much. Toradol is like an amazing anti-inflammatory. It's kind of like an IV Aleve on steroids. It's not steroids, but so that was to 2 weeks. So that's I guess what I wanted to say. Sorry this is so long. I hope you guys enjoyed it. I'm gonna make, I have a couple more videos in mind. So my next one's gonna be from 2 weeks on to 5 weeks, which is where I'm at right now. And I'll let you know more about how I'm doing and what my diet is now. And so the first 2 weeks, oh geez. So my start weight was 241.2. Surgery weight was 230 even. And then I had lost like 10 pounds the first week post-op, and then about 3 or 4 pounds the second week. I can list all that out to confirm. I'll link my Instagram below too, so you can follow me there. I have all of my stats and kind of some things that I've been eating and stuff. So definitely subscribe if you want to hear more. And one spoiler is I am switching to a plant-based diet. So if you're interested in how to be plant-based after you've had bariatric surgery, definitely follow me. And always check with your surgeon and your team. Don't follow my advice. I am not an expert on this. Okay, I'm just doing kind of what seems good to me and what I have gone off from the advice that I've gotten from my team. Okay, all right, I'll see you guys next time.